many of my previous speakers this afternoon, I am not a scientist. Unlike them, I am not a veteran. I'm an adult educator, and I serve as the executive director of the Aplastic Anemia and MDS International Foundation. As an adult educator, one of the principles we operate on is that the mind can only absorb what the butt can endure. And that's usually about 90 minutes, so I would ask you to be patient with me and for these next few minutes. We're aware that a number of men and women who have served in the armed forces of the United States during the Vietnam War era have been diagnosed with Myelodysplastic Syndrome, MDS, and have applied to the Department of Veterans Affairs, VA, for disability benefits. In the course of their applications and/or appeals, there have been some confusion and misunderstanding with respect to the etiology and severity of MDS, resulting in inconsistency in the approval or denial of benefits to veterans with very similar diagnoses and conditions. And hearing from both Larry and Bob, I think they made some very pointed cases. In an effort to rectify these inconsistencies and to clarify the nature, causes, and severity of MDS, the Aplastic Anemia and MDS International Foundation has prepared this testimony. The AAMDSIF is the world's leading nonprofit health organization dedicated to supporting patients and families living with aplastic anemia, MDS, and PNH, and other related bone marrow failure diseases. Guided by highly qualified and internationally known experts in the field of hematology, oncology, and epidemiology, and bone marrow failure, it is our hope that our testimony will assist veterans, their families, their physicians, and VA personnel in the determination of eligibility for well-deserved and well-earned benefits in an expeditious manner. MDS is a rare, life-threatening bone marrow malignancy that typically arises later in life. Although it was previously known as refractory anemia, or even before that, smoldering anemia, smoldering leukemia, the World Health Organization and the National Cancer Institute acknowledge MDS as a form of cancer. Data on MDS are collected and retained alongside data on lung cancer, prostate cancer, colon cancer, and other related malignancies. Specifically, the Myelodysplastic Syndrome are a group of bone marrow failure malignancies that cause abnormalities in all cells of the bone marrow and are characterized by ineffective blood cell production and bone marrow failure. Except for a few, less than 5%, select younger MDS patients who can undergo the rigors of an allogeneic stem cell transplant, there are no curative therapies for MDS. The symptoms of MDS, such as anemia and thrombocytopenia, are life-altering, and the disease itself is deadly, with a median survival rate of just 4 months in its most serious form. MDS also frequently evolves into a type of acute myeloid leukemia, AML, which is very resistant to normal anti-leukemia treatments. The potential for evolution to AML, along with the severity and lethality of the diseases itself, make MDS a severe condition. To further clarify, MDS is not a form of anemia, and it is certainly not a mild problem in any of its forms. The severity of MDS is not debated. To call MDS anything less than a potentially lethal disease is an error that belittles the men and women struggling with the disease. Currently, the etiology and risk factors that predispose individuals to MDS are not fully understood. In approximately 90% of cases, MDS appears de novo, but several root environmental risk factors have been identified. Approximately 10% of MDS cases are considered secondary to other causes. These include previous chemotherapy for other cancers, exposure to radiation either as a part of therapies, military or industrial toxins. It has been well established for decades that exposure to environmental toxins like benzene, petroleum products, and herbicides that contain benzene or other aromatic hydrocarbons predisposes exposed individuals to MDS and bone marrow failure. Agent Orange contains such potentially radiologic aromatic hydrocarbons. Multiple studies have shown that chronic exposure to these chemicals increases the risk of MDS, AML, and bone marrow failure. In particular, exposure to many herbicides has been linked to MDS and AML through a number of epidemiological studies and clinical observations. These findings have led researchers to conclude that exposure to this class of chemicals leads to myeloid malignancies like MDS, which in turn can lead to AML. On the basis of these and other rigorous clinical observations and molecular epidemiologic studies, specific toxins such as containing Agent Orange, or benzene petroleum products, or cytotoxic chemotherapy can damage bone marrow cells in some patients and may lead to life-threatening bone marrow failure and or myeloid malignancy. The amount of toxin exposure which results in disease is not known, but is clearly different for individual patients. MDS and AML are two interrelated bone marrow cancers, and indeed MDS may progress to highly refractory, full-blown AML over time. MDS is considered a myeloid cancer by several government agencies, including the Surveillance, Epidemiology, and End Results Program of the Centers for Disease Control and the National Cancer Institute. Veterans who have developed MDS or AML as a result of their service in Vietnam should be fully eligible for appropriate benefits. To aid in correcting the confusion and misunderstanding with respect to the etiology and severity of MDS, our foundation will be making additional information available to veterans and their community physicians, which clearly states the nature, severity, causes, treatments, and current thinking regarding MDS, so that the initial application for benefits or subsequent appeals can be best prepared. We will work with the VA in a cooperative effort to ensure that medical professionals reviewing veterans' disability claims have the very latest information about MDS through a program of continuing medical education developed and presented by some of the leading experts in the field of epidemiology, hematology, and oncology who serve on our medical advisory board. We ask that this committee support this effort by a recommendation to the appropriate offices at the VA. Finally, we ask the committee, as appropriate, to recommend that the VA undertake and or fund the necessary scientific studies to determine the specific relationship of exposure to Agent Orange and other herbicides to the development of MDS. We appreciate the committee's work on behalf of all Vietnam veterans, and we're prepared to provide you with a list of published studies and papers to assist you in your analysis and deliberation.